Hi, welcome back. Here I am with an important topic for discussion, that is priority. We are going to see the rhythm that can stop the heart wins always first. So let's go into the topic. Here I am going to discuss it with a scenario. Which patient is at greatest risk for death and requires immediate intervention? The options here are A. A patient with DKA receiving IV insulin whose potassium is 3.1 milliequivalents per liter and urine output is 20 ml per hour, and B. A patient with septic shock on norepinephrine with BP 88 by 46 mm of Hg and MAP of 60 mm of Hg, and C. A patient with acute pulmonary embolism who is anxious and has a heart rate of 34 beats per minute, SpO2 of 90% on room air and heart rate is 126 beats per minute. And option D. A patient with acute kidney injury and potassium of 6.2 milliequivalents per liter with a peak T wave on ECG. So these are the options. Please go ahead and think which would be the right answer. Please think. Yes, the correct option here is the option D. That is why? Because it says the potassium is on the higher side. And which patient dies first? This is the question which is being asked. So your hyperkalemia kills silently the patient because the patient is having very high potassium and there is an evidence of peak T waves in the ECG. And it is an eminent lethal dysrhythmia can arrive with no time, and it can get converted into V fibrillation without giving you any warning and without giving you any time. So the patient might succumb to death if untreated. So the cardiac electricity plays a very important role, then the oxygen and then the blood pressure. Here we can see why the other options are wrong. The DKA with low potassium is very dangerous. Here we can see why the other options are wrong. DKA with low potassium, it may be dangerous, but at this particular point of time it is not that important to get it corrected because it is okay range, that is 3.2, and there is no replacement required because the other option where the arrest is very near to happen, where the patient is going to get arrested with such high potassium in the option D, that is more important. And next one is option B, that is septic shock which is serious, yes of course, but the patient is already on vasopressin and pressors which is mentioned in the option, and the MAP, that is mean arterial pressure, is also in the borderline. It indicates the patient is not crashing at this particular second. And the option C, where it says the pulmonary embolism unstable but still oxygenating at 90%, there is no collapse or hypotension being mentioned in the option. So these are the option which says which is wrong. These are the distractors. So the priority law is